Welcome back. In today's Daily Health, we're focusing on the alarming racial disparities in America's maternal death rate. Last week, an autopsy revealed that world champion sprinter and three-time Olympic medalist Tori Bowie died from complications of childbirth.
The tragic news once again highlighting the fact that black women are 3 times more likely to die than white women from pregnancy-related causes. This, according to the CDC. Joining us now is Team USA Olympic track and field athlete Tianna Madison. Tianna, first, we want to just say how sorry we are for your loss. Can you tell us a little bit more about Tori, your teammate, your friend? How would you like for her to be remembered?
Yes, thank you for having me. Tori was such a light, so full of joy, and just a fearless athlete. She was a social work major, had a heart of service, a heart for people. And I think the world over is going to be reeling from her loss for a long time.
Yeah, and I'm so glad you're keeping her memory alive. Thank you for making the time to speak with us. I know you've been generally outspoken. You actually posted online and you said that as of June 2023, 3 of the 4 members of Team USA's 4x100 meters relay team who ran the second fastest time in history and brought home the gold medal have nearly died or did die in childbirth. We deserve better. We being black women. Can you just share with us your experience when you had your child, and also why you said that, how notable that is that you, Olympians, are still dealing with this?
Yes, it's such a stark image. It's because being top 1% in your sport doesn't give you immunity from this crisis. And in my own story, as an athlete who prides herself on knowing her body and knowing what's wrong with it at any given time, wasn't believed or listened to by my own doctors until it was almost too late. And so the reason it's important is that none of us are immune from this, and knowledge isn't even enough. We have to have the knowledge, get the awareness, but also relentlessly advocate for ourselves until we can dismantle the system that continues to perpetuate these inequities.
Relentless advocacy, that is such a beautiful way to put it. Since Tori's death, I know you've created a database of midwives, doulas, social workers, and organizations to help black mothers. Tell us a little bit more about your efforts to raise this awareness and how people can actually help.
Right. So as a social worker myself, I just feel the need to act. And what I wanted is, until we can demand more of a system that was not really created for us, we need to save ourselves. And so I really wanted to create this community atmosphere of a grassroots movement of, this is just one more place, because this is not new. I'm not inventing anything new. One more place for people to come find resources to build a team that can advocate on their behalf. Because until the system does, we have to save ourselves so that we can survive childbirth and raise our babies. We deserve that much.
Yeah, we absolutely do. Tianna Madison, thank you for the ways you're supporting black women and your friend's legacy. Stay well.
Tianna, thank you so much. We want to bring in NBC News medical contributor, Dr. Uche Blackstock now. So, Dr. Blackstock, we've talked about this before on this program, but remind folks the myriad factors that contribute to why black moms are more likely to die than their white counterparts.
Right, and it's so important to remember that it is multiple factors, and one factor is it's not race. Like, there's nothing intrinsically wrong with black women or black pregnant people. It's having to deal with interpersonal and systemic racism. On both the community and a personal level. It's about having to deal with clinician bias, having clinicians not listening to your concerns or complaints. And then finally, it's about not having resourced hospitals in your neighborhood. So even if you're of a higher socioeconomic status, if you're black, you're still more likely to live in a neighborhood where there are minorities serving hospitals that have poor quality of care and thus worse patient outcomes.
So many layers.
So many layers. And given those layers, so many black women have taken matters into their own hands. We heard from Tianna about that. What can black moms or expecting moms do to protect themselves?
Right. So like Tianna was saying, like, advocating for yourself is very important, but also, taking the lead and interviewing your OB or your midwife, making sure that you have a clinician that is culturally responsive and that is going to listen to you. Taking someone with you to your appointments is also very important. Getting involved with those community-based organizations that Tianna mentioned. There are a lot of doula organizations, midwife organizations that people can connect with. And then finally, just, utilizing your village and your community, getting referrals from family members and friends about their own experiences and if they had good experience with their clinicians.
And before we let you go, what should clinicians be doing to address this?
Yes, I know. This is so important. Clinicians like me need to listen listen to their patients, cannot minimize their patients' concerns. A lot of these deaths that we're seeing, the majority of them are preventable. These are young, healthy people. They should not be dying.
Tori Bowie was an Olympian, for Pete's sake.
Yeah.
All right, Dr. Uche Blackstock, thank you as always. We appreciate your time.
Really appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.